Hey everyone, so Morgan Gale, owner of Aesthetic Artistry Laser Center. Today I kind of wanted to focus our conversation on fractionated resurfacing lasers. So I have two of my favorite lasers behind me right here, non-ablative and ablative fractionated resurfacing. So I was going to answer a couple of your questions about some of the common things that I get brought up during our conversations for consultations, and hopefully that gives you a little bit more information about these two great treatments we have here. One of the most common questions I get asked during our consultations is, what is the difference between ablative and non-ablative fractional resurfacing? The big thing you need to understand is that these lasers are both basically doing the same thing in essence, but the ablative version is basically breaking down the entire layer of skin from the epidermis all the way through the dermis, whereas your non-ablative version is basically leaving the top layer of the epidermis intact, almost like a band-aid, and then doing all of its work below that in the dermal area. So in essence, what we look for is basically how deep is the penetration of these two devices. The ablative version is going to get a better penetration of energy deeper into the lower layers of the dermis, so you will get a little bit better collagen remodeling, you'll get a little bit better resurfacing. And then the other one, the non-ablative, you're going to get a little less penetration, but the nice part about that is you generally have a little bit less healing time. So in terms of what these lasers really treat, the beauty of them is that they actually treat several different things excellently. What they're going to do is they're going to resurface the top layer of skin, so you're going to get the newer, healthier, fresher skin to the surface. You're going to get rid of some of that sun damage, some of those old skin cells. You're also going to get some nice collagen remodeling, because as the energy penetrates into the dermis, that's where the collagen resides, that you're going to see that collagen plump. And the last thing that it really does is it actually does help to tighten a little. This is not a tightening procedure, but because of the way the injuries are created, we create these tiny little microscopic columns of injury in the skin, and all of those columns will heal as a purse string. So you can imagine hundreds and hundreds of these little columns all tightening together. You do get a little bit of lifting during that process. When it comes to recovery time, as I had mentioned before in terms of these two devices, where you're dealing with ablative and non-ablative resurfacing, the ablative resurfacing, because of its penetration of the energy, what you're looking at is a little bit more recovery time because there is a little bit more of an injury. The non-ablative version, what you're looking at is basically a lesser amount of recovery time because the injury is lesser. In both cases, your typical recovery time is redness, swelling, and some peeling. It's just a question of how long that process takes place. In the case of the fractionated resurfacing that's ablative, you're probably getting somewhere around 7-ish to 8 days of recovery time before you're completely back to normal. The non-ablative version, it's usually more like 4 to 5 days. So that's really kind of where we look to differentiate between the two in terms of the results of the treatment. How long does it really take for you to be back to normal? The ablative version a little bit longer, the non-ablative version a little bit shorter. How often do we really have to do them? Because obviously at the end of every consultation, that's really what we're talking about. They ask, Morgan, how many times am I really going to have to do this to get the results that I'm looking for? The reality is that the more aggressive treatment we do, the less likely you're going to need to do it more than once. So your ablative CO2 resurfacing treatment, I typically have most of my patients do once a year, and that's it. The non-ablative Fraxel type treatment, you're probably doing a series of 3 to sometimes even 5, about 6 to 8 weeks apart. And then from there, maybe we can move to more of a 1 or 2 per year to see some nice long-lasting results. I hope I've answered all your questions regarding these two great lasers that we have here at Aesthetic Artistry Laser Center. I love doing these treatments, both ablative and non-ablative resurfacing. If you have more questions, obviously, please call me, text me. You can DM me on Instagram. I love talking about these treatments and anything else we offer here. I look forward to seeing each and every one of you, hopefully in our chair real soon. I want to get to know you, and I'm hoping to get you started on your skincare journey.